In recent studies, it has been shown that there is a stagnant rate of sleep-related deaths in infants. The most common one of these is SIDS, which is also known as Sudden Infant Death Syndrome. This report is coming from the American Academy of Pediatrics. Many of these injuries and deaths due to infants in the past few years has been due to swaddling. While in some cultures it is common to swaddle children that are older than approximately 2 months, it may not be safe for them. Once an infant shows signs of rolling over or is starting to move onto their stomach, that is the approximate time to stop swaddling them. If they are swaddled after this point, they could roll over while being swaddled and may not be able to move, which could cause these injuries or death. Since the infant is no longer being swaddled, here are some helpful and useful safe sleep practices that you should follow to reduce the risk of SIDS and other sleep-related deaths in infants. One is making sure that the infant does not share a bed even with the parents. This increases the rate of suffocation and accidental strangulation. While you should have the infant in close proximity to the parents for their safety, it is not ideal for them to be bed sharing with anybody. Two is making sure that the bed surface is not inclined, making sure it is soft and has no floating pieces that they could accidentally choke on. This makes sure that they are more comfortable and not prone to suffocation or overheating. In some cultures, making sure that the bed is not inclined causes overbundling to make them more soft and comfortable, and that can be an issue to make them overheat and not be comfortable and cause injuries and death to them. So make sure that the bed surface is soft and firm, and that's very important to keep in mind. Three is making sure that the infant is placed on their back when they're going to sleep and introducing them to being on their stomach when they're awake and not asleep for their safety. It could corrupt their breathing and cause accidental suffocation as well. Lastly, make sure that the mother is not exposed to anything harmful during pregnancy and that the infant is not exposed to anything when they are first born through the air or even the mother's breast milk, such as nicotine and tobacco use. All of these steps are really important to follow and take into account so we can decrease the risk of sleep-related infant deaths. If you have any more questions or concerns, please go to the American Academy of Pediatrics website or look for more articles or recordings like this one here.